I'd just like to tell you, Dr. Strafas is planning on being here. He will be coming and have a few words later on. So right now, I'd like to pass it over to Ms. Patch.
Hello and welcome. I'm glad to see everybody here tonight. I was especially glad to see the menu with the grilled cheese sandwiches because I knew we'd have people then. Thank you very much. It was very good. Dr. Strafas has asked us to talk about family supports tonight, which is something that's very near and dear to me and our committee here. One of the things I wanted to talk about is that the handout that you have with the triangle on the front, did everybody get one of those? You'll see on the front it has the Maslow's hierarchy of needs. And I just think that it's so important for us to keep in mind where learning actually begins and how much there is to keeping a child learning at their best level and what's important to get them to that stage. And that's what we're going to be talking about tonight. It's just the very basics of what every child needs. At another time, I'm sure we'll be talking about the more integrated things that special ed has to offer, but this is just the basics that every child has available to them. So one of the most important things that we can do here at APS is to recognize the needs of the children and then to research to find out what's going on with them, to respond to their needs, to refer them to the appropriate people, and then to follow up and make sure that they have everything taken care of that they need. I am the Director of Health Services, so I'm going to talk a little bit about the medical needs, and then I will pass them down the line of our team here, and now each one will talk about different resources that they have for parents and different interventions, things that they have to offer. Then we will turn it over to you. Dr. Strafas was very clear. He didn't want this to be a time when we just stand up here and talk. He wants it to be the opportunity for parents to come up and ask questions or to express your concerns or your ideas for us. So we'll briefly go through the things that we do, and then you can help us determine what we need to do next. As the Director of Health Services, I just wanted to share with you some of the concerns that we have in the nurse's office. As of our last year's report, we had 327 students with ADD and ADHD, and with asthma we have 548. And allergic disorders, which seems to be our greatest growing number, was 268. That includes life-threatening and non-life-threatening allergies, mainly food allergies. Some of the resources that we have in health services that you may or may not know about is we've been fortunate to work with many of our community resources, one being the Lions Club. A few years ago, the Lions Club purchased a camera that just by looking at the pupil of a child's eye, you can detect over 13 different eye disorders. And that's been very, very beneficial for us. The child does not have to respond. They don't have to do anything. It takes about 3 seconds to get that picture, and based on the refraction of the light, they can determine many different eye disorders. So we're very appreciative of the Lions Club for supporting us in that way, and they take care of all of our kindergarten and pre-K students, which trying to check the eyes of a pre-K student can be fun. Also, the Shriners have been of a great support to us in orthopedic needs, helping children that need surgery, that don't have insurance. They've just been a great support to us. The Rotary Club in the past has helped pay for dental needs when a child doesn't have Medicaid insurance. And one thing that I wanted to share with you as well is UNM has got a new telehealth program whereby if a student has asthma and they are fairly severe, we can present the case to them. They have a panel of many physicians, a pediatric pulmonologist, and a whole support staff up at UNM. Once a month they get together. You can present the case over the phone. The parents can be a part of that along with the school nurse. They make recommendations and also appointments up at UNM if that's needed. So that basically allows them to have an appointment at no cost with a whole panel of medical experts. So we're very thrilled to have that opportunity. Also, I just got in the mail today that they're expanding that program to include meetings on pediatric nutrition and childhood overweight management. So in the near future, we're going to have opportunities to present concerns in that area too, which is a great need in this community to have access to nutritionists and pediatric doctors. Locally, I can't say enough about our local physicians that have helped us, that when we call, we get appointments. They're very good about getting the immunizations. Ben Archer Clinic has been very good at getting appointments on the spot for us. And our mental health providers have been great. One service that we also have that you may not be aware of is homebound services, which we try to keep limited. We try not to do it too much for chronic, but it's a good short-term assistance to families if they have an illness where they're not able to attend school for more than 2 weeks. We can help in getting a teacher in the home for a short term. It's not a good idea if it's going to be a long-term plan. It's not a way to maintain an education, but it's a great way to keep it going if you have a short-term illness. And I will pass it on now to my cohorts here, and they can talk to you a little bit about what they do in their areas. We have counselors, social workers, principals, lots of information here for you.
Hi, my name is Connie Howell, and I'm a counselor here at Chaparral Middle School. And one of the big parts of our job is to support parents. We support in really 3 different ways. One of the first ways we do is academics. We work on schedules. We give out STI numbers so parents can access their students' grades at home. We work with teachers and parents, and if there's any concerns about grades, and we coordinate those. We sit on meetings. So anytime a parent would have a concern, the counselors are the ones that you should contact, and we can help you. We also support parents. We often get calls about how to support their children emotionally and socially. Middle school is a big change, and one of the things we do is try to help students navigate, say, 6th grade. There are friend issues in middle school. There's hormonal changes. Students can be very emotional. So we talk to students about those changes and how to deal with relationships. Also, if there are family relationships going on, there may be families who've moved or are new to Alamogordo. There may be changes in the family like divorces, things like that that can affect a student's academic and peer relationships. We also do programs too on anti-bullying. We've done the Signs of Suicide program to identify any students who really may be struggling. And with that, we present to all the students these programs, and then individually we may work with individuals or small groups of students. If we see that there's a serious concern, what we will do is we will notify the parent and perhaps enlist outside help or outside agencies to help address these needs with the students. So if you ever need help with your student and you want to get more resources, please feel free to come and contact the counselors, and we're there from 7:30 to 4 o'clock to help you. Thank you. And our next presenter is Brenda Dorsey.
She told me I had 3 minutes, so I'll make it brief. I think most of us, when we think of what a principal's role is, we think it's discipline, and that's the support that we provide to families, is discipline their kids so that they'll learn in school. But that role has changed incredibly over the years, and I think we wear a social worker hat a whole lot more than we wear a principal hat, as far as what the old role of a principal used to be. At our school, one thing I'm going to talk about is the parenting classes that we offer. A year and a half ago, I partnered with CHINS, and we provide parenting classes. They're 8-week classes, and one thing we stress to the parents is that you don't have to be a bad parent to be a better parent. And so just like we're always lifelong learners, then we try to get our parents to be likewise. And the first The first time we did it was a year and a half ago, and they're 8 weeks consecutively. And because I was able to partner with Chins, we have some incentives that are in place. But the first year we did it, we had our PTA that did daycare for us, or child care, and then the parents were enticed with a $50 gift card, and I kind of hand-selected who I would like to be there. The second time, we just opened it up to the whole school, and at that time, one of my teachers had attended the first 8 weeks, and she said, you know, I'd really like to work with the kids during that time that you guys are working with the parents. And so now I have a teacher and my counselor that work with the kids while we're working with the parents. And I say we because I sit in on all of those sessions. Occasionally I'll get pulled for a meeting, but I do sit in on the sessions. And we've asked the parents if they want that, and they've said unanimously yes, that they want me to sit in, which I think that says something in itself when the parents are attending a parenting class and want the principal to stay with them. I guess we could look at it either way. Maybe they're saying I need more of those skills. I don't know. But anyway, this will be our fourth time coming up. We gave a week after Christmas to not start, but the big dilemma in that is to try to make it where all parents would be able to attend, because her time schedule is real restrictive, and so is mine. So right now we have them on Tuesday afternoons and after school. But we're getting a pretty good group of parents, and we're having parents come back and tell us that it was really one of the most beneficial things they've ever done. So that's one of the things we do at my school. All of our schools have some type of after-school programs available. I can only speak for my own, but I know that we have first a math club after school, we have a reading club, we have a puppet club, we have a chess club. Those are all things that I feel that we do to help parents. A lot of times it serves a daycare or extended school day because of babysitting needs, and then a lot of times the kids stay, even if there's no needs for that. We have some latchkey kids that are staying to our after-school programs, and as far as I'm concerned, that's what we're there for. So anyway, we do a lot of things for the families. I have them on listservs, and I encourage all my parents to get their emails on my listserv so that we can communicate back and forth. It's like Lisa said originally, we wouldn't be on this committee tonight if we weren't passionate about this area. And this is an area that I am passionate about. So anyway, if I can help further, they made us beautiful business cards for tonight, so please come by and get one of mine. Thank you. The next one is, I just met her tonight, but I believe her name is Carrie, and she'll tell you. Carrie, correct? Okay. Anyway, she'll be up next. Thank you.
Good evening. My name is Carrie Willis, and I am the Student Assistance Team Coordinator at the high school, and I was asked to come and talk to you about just a brief explanation of what the Student Assistance Team does. The Student Assistance Team at each school, for me it's the high school, but for each school within the district, addresses the needs of the students that do not fall within the regular classroom. For example, if a student is struggling, that student would be referred to the Student Assistance Team, which we call the SAT, and then the SAT would sit down and determine the best avenue to serve that student. The SAT team is made up of principals, counselors, teachers, the parent, and myself, and also on occasion, like at the high school or possibly middle school levels, our truancy officer, anybody who would have insight into how best to handle the situation for a student. The SAT also, or does not only address academics, we address behavioral issues as well as emotional issues. So basically anything that happens outside of the regular classroom setting for instruction would be referred to the SAT. Who can refer to the SAT? A parent, the teachers, counselor, definitely a principal. In the case of truancy, the training officer refers us to SAT, and then we meet, we discuss the case, we determine the best avenue to address that student's need. So it's a case-by-case situation, so it's very difficult to kind of discuss without having specifics, so if anybody has any questions, please come up and you can ask a question or get a card or contact a principal at your particular school. So Kathy is next.
Let me start out by asking, how many of you served in the military services, one of the military services then? Why don't you raise your hands up high? Awesome, awesome. Thank you for your service to our country. How many of you have been married to someone who has served in the military? Okay, we've got a few more hands. Thank you for your service. Now, how many of you have been Air Force brats or military brats then? And a few more hands. Excellent. About 2 years ago, my boss, Dr. Jan Hunter, realized that there was a unique need in the Alamogordo school system and within our community, that we have a large military population here. And she, with the help of some other folks, then wrote an outstanding grant called the Power Up Grant. It's about $1,250,000, which we received, and has been working with getting English and book materials to computer to our schools. And that also helped fund my position, which is the Military Transition Counselor. And so I've been in this position now a little over a year and working with military families. So that's my job, is working with military families and helping to recognize and address the specific and unique needs that they have. As an Air Force brat and a military wife of 20-something years, actually been married a lot longer than that, but that's how long I was in the Army, then I feel uniquely qualified to fulfill this role and have just really enjoyed what I've been doing. I recognize some faces because many of you attended some special training that we had at the end of September. It was called Living in the New Normal, and it was specifically addressing the needs that students children might have if a parent was injured or came back from deployment with a unique need. Perhaps they had suffered from post-traumatic stress disorder or had lost a limb, or just tried to come back to being in a normal environment after being in the war area. And so I appreciate those of you who attended that training because it was very, very influential. And I think it helped raise the level of consciousness about the military needs in our community. We are so blessed because the Military Child Education Coalition wants to come back to Alamogordo. They were so pleased with our response in September. We're going to come back again the end of February 21st and 22nd, to offer some more training. And this is specifically oriented towards our Guard and Reserves. Now, perhaps you've heard in the news recently that we've had about 400 New Mexico Guard folks coming back from Kosovo. How many of you guys even knew that we were still in Kosovo? That's a few hands there. And we currently have another 400 New Mexico Guard who are returning to Kosovo. And so it's a very real need. Out of the 6,300 students we have here in the Alamogordo Public Schools, about 20% of those students then are military. And that would include then our Guard and Reserve. So you may have a student in your classroom, and many students in your schools then, who are going to be reserve, guard, active duty military. And it's very important that we recognize the unique needs that they have. Some of their parents have been deployed 4, 5, even 10 times, which to me is just incomprehensible. And so please join with me then in taking care of the military kids. And if you have any questions, I'm always more than glad to answer them, or if you have any needs that you're concerned about, just get in touch with parents. Hooking them up with other resources to include Gigi McKinley. Gigi, why don't you stand up? Gigi is our school liaison officer from Home and Air Force Base, and we work very well together. I was going to say Mutt and Jeff, but I better not go there. So, but Gigi is just a wonderful resource for us as well. But it is an honor and a privilege for me to work with Alamogordo Public Schools, and certainly to work with our military families. So, any questions? Please let me know. Thank you. Shunda.
Good evening. My name is Shunda Bertrand, and I have been asked to come and speak to you this evening because I am coordinating the Positive Behavior Support Program. And the program that our district is using is called the CHAMPS program. And the CHAMPS program is just a positive, proactive way to approach behavior within our district. The program really focuses on not changing the child to fit the system, but changing the system to fit the child's needs. And there's some really shift in culture and a shift in the way that we think. within the CHAMPS program, we look at structuring our classrooms effectively, teaching our expectations, observing the child's behavior, interacting positively with children, and correcting behavior fluently. And I have been working with the middle school staff since, I think, October, and we're looking at getting a district model for behavior within the district. And I've recently began working with the elementary staff so that we will have a district model for behavior. And it's not to say that all schools will have the exact same program, but we want a structure from which we work from to address behavior and discipline issues within our district. And as we get the structure, then each school will individually create their own plan or their own discipline plans to address behavior within the school systems. And I will be here to answer any questions you may have about discipline or our approach to discipline within the district. Oh, I'm sorry. Isela will be the next speaker.
Hello, my name is Isela Sain, and I'm the social worker for the district. Also the family liaison. As a family liaison, I do work with families to provide services to families. My role is to link, assess, identify, and coordinate services for families who are in need. And this can be any situation, any crisis. So in order to facilitate the wellness of the family and the stability. I also work with a homeless education program, which is to address and identify children who are homeless. And 90% of our children, up to the end of December, we had 105 homeless children. And I would like for you to be aware that this population, our school district, is serving these children and families. And what we do in the schools is find the resources, link them to those resources, and provide the services in order for them to become stable and stable and well, and for their well-being. Also, I wanted to let you know that causes of homelessness in our district that impact our families are unemployment, underemployment, domestic violence, and economic hardship. A lot of our families struggle economically, and I need your help in order to identify those children who might be prone to homelessness. So please, if you know of any families who might be becoming, who become homeless, please, you can get in contact with me at Sacramento, or you can get one of my cards too. Also, I wanted to tell you about the program, the backpack program. We have in our district about 60 to 70 backpacks that go home every weekend to families, to children who might not have enough food to eat during the weekend. So we have very generous people in our community, and I want to thank those who are helping us to meet the needs of our kids in our district. And if there are any other questions, please feel free to contact us, our schools. Thank you very much.
Okay, if you'll take a look on the inside of your pamphlet, there's just a few acronyms in there. I know sometimes going to the schools can be a little intimidating when you don't know who to reach out to or what terms they're using. So there's some familiar acronyms that you might be hearing if you go to the schools, and definitions, so you can know what to expect when we're visiting with them. Now we have an opportunity to hear from you, and we look forward to it. We hope that you will come up and ask us questions, give us ideas, or even if something's working good, we always like to hear that too. So we're here at your disposal to get your advice and to better serve the Alamogordo community. I will have the microphone up here. Please come up here and ask your questions, and then we'll direct it to the panel member that it applies to.
We don't have to rush.
Questions? We're doing everything great? Yes.
I'm astounded then to know that we have 70 children, 70 families that are receiving backpacks every weekend because they don't have enough food. Isla, what can we do then as community members to support that effort?
What I think we can do as a community to support the effort is just if you have any non-perishable foods that you might be having at home, or if you can buy any juice, bring them to Love Inc. or just contact me at the school. I will bring it to Love Inc. and they're the ones who do this very, very generous. And I wanna tell you who that person is who coordinates that program. And her name is Susan from Love Inc. Thank you, Susan. Susan works with our families. I go to her a lot for anything that we might need, that our parents might need. So she's the to-go lady. Any other questions, concerns?
I would like you to define homeless children, because people are going to see 105 children out there in the desert.
Yes.
People are going to think that there's 105 homeless children out there in the desert, so I think you should define that.
Yes, and that's one thing I needed to do, and I'm going to tell you what it is. We define homelessness as a person or child who lacks a fixed, adequate, regular nighttime place to sleep. And it doesn't mean that they have to really, we have maybe a couple who were sleeping in a car, but mostly 90%, 95% it's double up. That means living with family members, living with friends, sharing the house of others because of economic hardship. Due to the home crisis and unemployment is what happened. Most, like everyone, all of the families are double up. They live with someone else. Any other question?
Excuse me. The board would like to hear the
I know the answer to this, but can you explain to us how we determine the students that are homeless? Can you tell us a little bit about the form that we do to...
Yes. When a child enrolls in school, there is a form, a New Mexico residency form from PED, and there are some boxes. Once they check a box saying they live with someone, they live in a hotel, then that check mark will qualify the person, the child, as a homeless. And it can be waiting foster care. It can be living with someone that is not a parent. They can be living with friends, there's many categories that it will identify, and once they check that box, they will be eligible to receive services. Once that happens, we go through those forms, and we kind of not confirm, like call the person the teacher or the principal, whoever knows the child, the student. And the teacher, I think, is the appropriate person to refer because they work with them every day and they know what they're going through, the family dynamics, and it's how we identify those children. Any other question?
It's more of a statement than a question. How about publishing a list of suggested items? I know of 2 organizations I'm involved with that are starting to look into helping support the thing, but usually when we go to the store, we scratch our heads and think, is that appropriate for the backpack? Is this not? Something like so. Suggested list. These are the things that seems to work well in the backpack. Please keep your eyes open. We saw a sale not long ago and we happened to hit one item accidentally. But most of us, when we're shopping, we don't know what is best to pick up. Suggest a list for us.
Yes. I have the person here who's in charge of that, so I'll pass it to her.
Okay, so you have to keep in mind that a lot of these kids may be living without a utility, like electric or gas or water. Hard to believe, but they are, and that's not necessarily considered child abuse, so they're not going to be taken out of the home. So we need to give them things that they don't have to cook. So they can't be anything like ramen noodles. I know everybody thinks they're great, but you have to cook them. And I want to take a chance that it's not going to be productive for them. So it's things that are easy to eat, like the little like ravioli bowls or spaghetti bowls. You can get them at the dollar store. You know, fruit cups. Those tuna kits are really great. We put those in there. We get so many of those. Those poor kids are going to get sick of those. The cheese crackers are great, but they are really inexpensive, and so we do get a lot of those for donation. And it's not that I don't appreciate them, but they'll get really tired of them really quick. So I'm trying to kind of get the more expensive items. I mean, like the little cereal boxes. You can go to Sam's Club, you buy a box of 30, it's like $10, and it feeds 30 kids. The other things, and they're a little more expensive, but they're really hard to get, so I'll just put my plug in since I have this opportunity. Those little milk, they're shelf-stable milk, and they look like little juice boxes, but they're just shelf-stable milk. You know, we give them a little box of cereal, a little box of shelf-stable milk, and they've got breakfast. And, you know, it's very economical. Buy the milk, buy the cereal. We can feed a child breakfast one day for like $1. So those are the kind of things that the biggest thing to keep in mind is not anything that has to be microwaved or cooked because they may not have a utility. Yes, ma'am. I did not intend for this to happen.
What about fresh foods? Do those go out fast?
Whole foods? Yeah, if we can.
Fruit.
Yeah, okay, yeah, fresh fruits like apples. I wouldn't suggest bananas, but apples might be okay because bananas, you know, they get ripe really quick. And so unless they're, I wouldn't suggest that, but we do put apples in there. Carrot sticks, those are good. The little, they make, and everything now, you know, they make those individual. So if you can get them and get them down to us so we can get them out that same week, it would be fine. I don't want to put something in there that's, you know, going to be. I am so sorry. I did not intend this to happen, but that's okay. I'm glad you're interested.
So if we wanted to donate, where would we send it to? Who would we get in contact with?
If you wanted to
donate for the backpack?
I've got business cards, actually. I just happen to have some business cards, and I will give you one. Do you want it? That's my office number. I will tell you, I really appreciate that you guys are taking such an interest in it. I did want to tell you, the kids that get these backpacks, they're not necessarily all homeless, but they are in need. And so I wanted to make sure that you knew that I wanted to make that distinction because I didn't want you to think that we're just giving them to homeless. Some of these kids, you know, they have a place to live, but they don't have enough. And so our goal is to make sure that whatever mom and dad are doing, it could just be working. It could be, you know, drinking. It could be, I mean, you know, let's be honest, right? It could be any of those things, but whatever they're doing, those kids on the weekend will be able to feed themselves. And that's because we know they get free breakfast and lunch during the week. So that is our goal.
I want to take this opportunity to thank all those people who has helped us. You know, I do get a lot of referrals from parents and families who are struggling, and thank you all. You know who you are. A lot of faith organizations are placing our families in apartments, helping with utility bills, with anything, so they don't get bothered. So thank you, and God bless you.
Questions?
This might actually involve several of you, and I know it's going to involve us both. Being an ex-military member myself, I remember when I came back from overseas, there was a quiet but very, very strong hatred of the people that we had to fight. And as some of them came to the U.S., the kids picked that up. And it got to be a real problem in the schools. And now we're looking at a situation where we have Middle Eastern people, many of whom lived in this country or often before that war started. But they're starting to feel the effects of the pressure from these kids. They're seeing their dads come home hurt, their moms come home hurt, and they're blaming somebody. They've got to blame somebody. So they blame what they think is the same people. And it's not necessarily true. So how do we get this across to the kids?
I just want to say real quickly, a lot of the work that we're doing around bullying and acceptance and tolerance, for a variety of reasons, I think will influence that a great deal. You know, overall, whether it be because of war or misconceptions or whatever, I think that we're really taking a serious look at the bullying issue and acceptance overall.
Thank you. That's exactly what I would say, Lisa, but certainly I think that we are a school district that honors and respects all people, regardless of your race, your ethnicity, your sex, anything like that. And so just mutual respect and appreciation for one another is certainly essential to having a healthy school climate. And really, when you think about it, all of us are here. Candace Carrie's a teacher, Brenda certainly a teacher. But we are all here then to make sure that children can learn, have a safe learning environment. And so that saddens me to even know that that's a possibility, but that's the world that we live in. And so I appreciate Lisa's comments, and certainly we've heard this from other principals, and that there's a zero tolerance for bullying. And I agree with all the principals here. I think that we have so many principals here, I'm sure that everyone would agree with that. Thank you for your question. Next.
Are we as an area going to be able to do some emotional support for the young man that has leukemia? Noel, how do you say it, Hauke? That was a student at, I believe, Yucca. Are we going to be able to possibly do some form of encouragement for that family and cards or El Paso's coming out in full force giving blood like mad. They can't even keep up with the number of volunteers. And I wish Alamogordo could do something to show the family support.
We've had a number of families that have suffered through illnesses, and individual schools have done different things, and there's certain things that we can do for individual families to support them. As far as talking about individual families, I think that would probably be a conversation with that school principal. Does anybody else have?
Usually situations like that are brought to our attention, our individual schools, and then we usually start at our own schools to see what we can do, and then we branch out from there. sure they can, somebody can address that. I'm not familiar with the situation myself, so.
Okay, next. Those grilled cheese sandwiches are sitting in, I can see them in there. I just wanted to put a pitch in for the, it's amazing the number of clothes that we go through in the nurses' offices too. If you have children that are outgrowing their clothes, and especially the little bitty sizes, your school nurses would be thrilled to get a couple t-shirts or a pair of jeans or something, because especially the littler sizes, there's more accidents, and to have something for them to change into right away is a nice thing. So I've got a brand new package of socks, and doesn't take much to thrill us, but that does. Questions?
Hello, I'm Sandy Harnett, and I'm a retired teacher. A lot of you already know me. My concern is that you all have things that need to be done. You see things that need closed, and these other things. The trouble is, a lot of us are not informed. I don't hear about a lot of this. There's got to be a way for us to be told and how we can help. We all have a variety of backgrounds. Mine is really a dependent kiddo, World War II, and also, like her, military wife, and also a teacher who's been in many states. We'd like to know how we can help. This is my home now in Alamogordo, and that's why I stay involved. But a lot of times we just have not received the word. We need a way of seeing that we're told and how we can help, and maybe contact us or some way to get that word out. I know Bob Flott often will do a lot of things on his radio show. I think we need to get the word out there, what each of you feel that we can do as a community to assist and help you.
Thank you, Safi.
Safi, one of the things that one of our goals for the district is to work on a comprehensive community involvement plan. And part of that is to intensify our website efforts, and maybe that will be something that we can look at through that goal team.
I just want to thank Dr. Strauss tonight for giving us the opportunity to start this conversation and to open up the dialogue. And I think it would be an easy thing to add to our website. Okay. Questions?
My name is Angela Trout, and I'm here with AlamogordoLive.net, and I want to let all of you know that if you have information that you want to get out there, that you want to get to the community, or questions that you might not know about city commission or school board or any of those avenues, we're really working hard to get that out on the internet, out to you guys. So if you have information that you want to put on there, we can put it on there also. If there's contacts for these things such as clothes or various connections, we can get them on there for you.
Thank you so much. Okay. Any other questions? Thank you so much for coming. I'll turn it back over to Adrian.
Basically, what I'd like to say is thank you all for coming out and listening to the supports that are out there for our students. I'd like to thank the panel for taking the time to be here and talk about what you all do. Thank all the parents, teachers, administrators, the school board that's here listening to our parental concerns. Parents, thank you for coming out and listening. I ask you one favor, and that's that whatever you heard today, go out there and tell other parents that might have a need for these resources. That would really be beneficial for a lot of students. So if you can pass on the word that we do have services and we do have supports that are available, and if not, we'll go out and we'll look and see what we can do. So again, I thank everybody for coming out tonight. Thank you very much. Thank you, board, and parents, staffs. You all have a great evening.